I am making this video to give you tips you need before and after meniscus repair surgery. My personal and professional experience backs this advice. Well, I had a sports injury that landed me with a torn meniscus. It was quite unexpected. However, after a thorough counseling, I decided to have the operation. So, 2 weeks ago in Hamburg, I underwent meniscus repair surgery. And let me tell you, it's been a journey. The surgery went well, but the recovery has been a test of patience and resilience. As a healthcare professional myself, I know how important it is to be informed and prepared before facing any medical procedure. Knowledge truly is power in these situations. That's why I wanted to share my experience with you all and offer some valuable tips for anyone out there preparing for meniscus tear surgery or recovering from it. I hope my journey can provide some insight and comfort. In this video, I'll talk about what I've learned, the steps you can take to prepare yourself, and the practical things that helped me through this journey. This video is for you if you are interested in pre-surgery prep to post-surgery recovery information and tips. Before undergoing any type of operation, especially one involving your precious joints, knowledge is your best friend. It's crucial to arm yourself with as much information as possible to make informed decisions about your health. Being informed gives you a sense of control and helps alleviate some of the anxiety that naturally comes with surgery. When you know what to expect, you are in a better position to ask your doctor the right questions. Besides, you can mentally and emotionally prepare yourself better. Start by learning more about meniscus tears. Understand your knee's anatomy, the meniscus's function, and how a tear can impact your mobility and overall health. Watch videos like this one, but don't stop there. Visual aids can be incredibly helpful in grasping complex medical concepts. Read articles from reputable medical journals or websites like the Mayo Clinic. Remember, knowledge is power. The more you read, the more questions you might have, and that's good. Most importantly, don't be shy. Ask your doctor your questions. Ask your doctor if he or she has animated videos to help you visualize the planned operation procedures. They are there to help you understand every aspect of your condition and the upcoming procedure. Write them down beforehand so you don't forget anything during your appointment. This way, you can ensure that all your concerns are addressed. Your doctor is there to guide you and address any concerns you might have. They can provide insights that you might not find online or in books. Remember, no question is too small or insignificant. Every piece of information can contribute to your overall understanding and peace of mind. The more you understand about the procedure, the risks, and the recovery process, the more confident and prepared you'll feel going into surgery. This preparation can make a significant difference in your recovery journey. Trust me, that peace of mind is priceless. It can transform your surgical experience from one of fear and uncertainty to one of confidence and calm. Alright guys, let's talk about getting your home ready for your post-surgery comeback. Preparing your space ahead of time can make a world of difference in your recovery journey. It's all about making sure you have everything you need within arm's reach, so you can focus on healing. Trust me, having these essential items on hand will make your recovery so much smoother. You won't have to scramble or stress about missing something important when you should be resting. First and foremost, crutches. Your doctor can prescribe them, which makes picking them up from a medical supply store a breeze. Make sure they are adjusted to the right height for you to avoid any additional strain. Crutches are your new best friend. They'll help you navigate those early days when putting weight on your leg is a no-go. Practice using them before your surgery so you feel confident and steady. Next up, long plastic bags. These are crucial for keeping your dressing dry while showering. You can find specialized waterproof covers, but even a sturdy plastic bag can do the trick in a pinch. You don't want any water sneaking in and causing an infection. Trust me. A little precaution goes a long way. Make sure to secure the bag tightly to keep everything dry. Ice packs are your new best friend. Keep them in the freezer and ready to go. Consider getting a few so you can rotate them and always have a cold one available. Icing your knee will help reduce swelling and inflammation, which in turn will ease the pain. Aim to ice your knee several times a day, especially after physical activity. And of course, don't forget the pain meds. Your doctor will prescribe what you need. Make sure to follow the dosage instructions carefully to manage your pain effectively. Having them on hand before surgery means you won't have to worry about a thing when you get home. Keep them in a convenient spot so you can easily access them when needed. Other essentials include antithrombosis stockings, which help prevent blood clots, disinfectant, plasters, and sterile compresses for dressing changes. These items are vital for keeping your surgical site clean and protected. Sterile compresses for dressing changes and bandages. Make sure you have enough supplies to last you through the initial recovery period. Having these items readily available will make your life so much easier during those initial days of recovery. Being well prepared means you can focus on healing and getting back on your feet as quickly as possible. Now listen very well, because this next tip is crucial. Don't try to be a hero and go through this recovery alone. Having a solid support system makes a world of difference. While doctors might tell you you'll be up and about in a day or two, reality can be a bit different. In my case, it took almost 2 weeks before I felt comfortable carrying things around the house. So, be prepared for a potentially longer recovery period. It's always better to overestimate than underestimate. Having someone to drive you home after surgery is non-negotiable. You won't be allowed to drive, so you'll need someone to help you at home in the first few days. But it goes beyond the initial days. Having someone to assist with everyday tasks like cooking, cleaning, and grabbing things for you can be a lifesaver. Remember, you cannot stand easily on your 2 legs in the first few days after the operation. My greatest challenge was being on crutches and trying to make breakfast and transport it to the dining room. I had to improvise by using a rope tied to the tray to transport my meals when my wife was not home. Don't hesitate to ask for help. Your friends and family will be more than happy to lend a hand. Guys, if there's one thing I can't stress enough, it's the importance of physiotherapy. This is non-negotiable. Physiotherapy is your golden ticket to regaining strength, mobility, and getting back to your old self. If possible, try to get a prescription for physiotherapy before your operation. This way, you'll have everything lined up and ready to go once you're cleared to start. Physiotherapy will involve targeted exercises and stretches that will help strengthen the muscles surrounding your knee, improve flexibility, and restore your range of motion. It might seem challenging at first, but trust me, the results are worth it. Remember, consistency is key when it comes to physiotherapy. Stick to your therapist's recommendations and attend all your appointments. The more dedicated you are to your recovery, the faster and smoother it will be. Alright guys, this last tip is all about staying active. Now I'm not talking about running a marathon or hitting the gym hard. We're talking about gentle movement that won't strain your knee, but will keep things moving. One of the worst things you can do after surgery is just lie in bed all day. While rest is important, too much inactivity can actually hinder your recovery. It can lead to stiffness, muscle weakness, and slower healing. Of course, always follow your doctor's recommendations, but remember that gentle movement is your friend. Even simple exercises like ankle pumps, quadriceps contractions, and gentle leg raises can make a big difference. Think of it this way: motion is lotion for your joints. Keeping things moving will help reduce stiffness, improve blood flow to the area, and promote healing. So, get up, move around gently, and help your body recover faster. Guys, remember that recovering from meniscus tear surgery is a journey, and it's unique for everyone. Be patient with yourself, listen to your body, and don't hesitate to reach out to your healthcare team if you have any concerns. By following these tips, being prepared and staying positive, you'll be well on your way to a smooth and successful recovery. And remember, this setback is just a temporary bump in the road. You've got this. Take care, stay informed, and I'll see you in my next video.